Welcome back. Nick Hart is still with us, and we're now joined by Patty Holcup of Dementia-Friendly Missoula. Patty, thanks for joining us, and I do want to talk to you about Missoula in just a minute, but before we do that, Nick, can you just start us out by explaining what a dementia-friendly community is?
Sure. It's a community where people with Alzheimer's disease and other forms of dementia and their caregivers are treated with respect and dignity and are encouraged to participate in community life. So it means informing the community so it's a safe and supportive place for people with dementia, getting community businesses on board to develop dementia-friendly practices, putting emergency intervention and prevention programs in place so caregivers and other people in the community know what to do in the event of an emergency involving dementia, training law enforcement and other emergency responders appropriately, and then focusing on initiatives that take action against elder abuse, especially in healthcare settings like nursing homes or assisted living residences.
Okay, great. Thank you for that. And so, Patty, Missoula has taken this on. That's one of the communities in Montana working to become a dementia-friendly community. How did Missoula start?
Well, we got our start by having, there were about 4 or 5 people who were involved with a statewide effort to develop the Montana State Alzheimer's Plan. And we would meet every couple of months in Helena, so this group got to know each other in the car on the way there. And several of us had been caregivers, and we traded experiences and shared frustrations and gaps that caused some of those frustrations, gaps in the healthcare system. So as we collected data for the state plan, we realized that we weren't alone. And so we came back to Missoula and said, we want to do something about Alzheimer's to make things better for both people with dementia as well as their caregivers. The gaps were just an example of a couple. Upon diagnosis, a patient might ask, well, now what should I do? And too often the answer was, we don't really know. The other thing is early diagnosis wasn't always happening. People could come wanting, with concerns about cognition, but because of the misperception that there's nothing that can be done, I think that care providers weren't comfortable giving a very difficult diagnosis. The first year goals that we had was to raise awareness and provide support and education to individuals with dementia and their caregivers at the point of diagnosis. And the second year we added promoting a perspective change from a limitations-based cognitive decline diagnosis to a strength-based perspective. And that's when we began to think we want to move toward helping Missoula become a dementia-friendly community. We had 4 agencies who were very supportive of us: Missoula Aging Services, the Montana Geriatric Education Center of the University of Montana, and the Rural Institute from the University of Montana, as well as the Montana chapter of the Alzheimer's Association.
Okay. And you mentioned the gaps in the healthcare system. Can you talk a little bit about what you've done so far to help the healthcare providers be a little more comfortable with dementia and Alzheimer's?
Definitely, and that was our first efforts. Our first efforts were 2-pronged, focusing on primary care providers as well as the consumer of healthcare. We developed brochures that we could distribute to provider offices and clinics where they'd be in the waiting room so that folks who were being seen could take a look at these brochures. In the brochures were lists of community resources to answer that question, what's next? As well as 2 brochures from the Alzheimer's Association. Nick has just mentioned Know the 10 Signs, Early Diagnosis Matters, and Principles for a Dignified Diagnosis. That would help the consumer think of questions to ask and what to expect. We've also had 2 Friday morning medical conferences, one each year. These are continuing education times for care providers, primary care providers, a panel with to provide the subjective experience of either being a caregiver or someone with dementia. 3 people talked about their experiences. The one who had his dementia, about his experience when he received the diagnosis, what he went through as he was kind of absorbing this and realizing he needed to redefine his life, although he was still the person he always was, but just couldn't remember like he used to. We had a vendor table at the Missoula Montana College of Physicians annual scientific conference, and really tried to promote information about the new CMS code, which allows for care planning post-diagnosis. So that again addresses the what's next, do we do. We've had Dr. Hartley from the Alzheimer's Association, Director of Science Initiatives, speak at another medical conference, spoke to the University of Montana faculty and students primarily in the helping professions, and at the Western Montana Family Medicine Residency Program. So speaking to students who are coming up. And then for the past 3 semesters, we've also had the 3 semesters we've had students from Montana State University College of Nursing who have worked with our group for a program called Population-Based Nursing Care in the Community. They've learned a good understanding about dementia, a little bit about reaching out and engaging the community, and then they take some of our PowerPoints, our teaching PowerPoints, back to their fellow peers, primarily the junior students.
Okay. Sounds like you've done a lot.
Yes.
And that's great. And if there are other communities, I know some are already starting, but if people are interested, we'll make sure to put a website for them up on the screen. But we are out of time. So Nick, Patty, thanks so much for being with us.
Thank you.
All the best to both of you and your future endeavors as you work on Alzheimer's and other forms of dementia. And thank you so much for joining us this week. We hope you'll come back next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.